Hello, this is Dr. Puja Ghosh, consultant ENT surgeon. As a ENT surgeons, we treat diseases related to nasal obstruction. So most of the times, if you see, this is the commonest complaint related to nose which we get in our day-to-day practice. So nasal obstruction, the most important cause and most commonest cause if we see is deviated nasal septum. So deviated nasal septum is very common and at least 70% of us are actually having it. But if it really causes some kind of trouble like nasal obstruction, mouth breathing, continuous mouth breathing, not able to breathe and not able to sleep at night due to the nasal obstruction, and in long term if it is not goes untreated, it may give rise to headache, sinus headache, post-nasal drip, even bad breath or halitosis. So all these are actually easily treatable. So if you see this deviated nasal septum, why does it occur? It occurs mostly due to genetic causes. So by birth, most of us may have a deviated septum. Some are caused due to trauma to the nose. So any cricket ball injury, or while playing you get hurt on your nose, or you have a fall or some road traffic accident may lead to deviated nasal septum. So in all the causes, the treatment remains the same. So if you see diagnosis, how can we diagnose deviated nasal septum? If you come to ENT surgeon, surgeon will do a proper clinical examination where we can see which part of the septum is deviated. If required, you may have to undergo an endoscopic examination and also a computed tomography, that is CT scan of nose and paranasal sinuses, which will give you a better picture and your doctor will be able to plan the surgery. So since the deviated septum is due to it's a bone or a cartilage which is deviated, it is not medically treatable. And what happens most of the times, people who are suffering from deviated septum tend to be taking lot of over-the-counter medications like Otrivin or like xylometazoline, oxymetazoline drops, which in turn increases their problem, and when they come to the surgeon it is always complicated. So if about the surgery, for the septal correction surgery, it is a very safe surgery. It doesn't have any impact on your external appearance of the nose. It doesn't have any scar. It is completely scarless and it's an endoscopic surgery. And most importantly, it's a daycare surgery. That means you come and get admitted, you get operated, and within 24 hours we remove the nasal pack and then we send you home. And after the surgery, post-op cares, whatever your surgeon is actually telling you to use, if you continue to use that, you will definitely have a better nasal obstruction will get better, and definitely you will have a better quality of life. Thank you.